I think it's safe to say tattooing is not going anywhere. It has been around for centuries as a symbol of culture, self-expression. You can find evidence of tattooing dating back to as early as the remains of ancient Egyptians. Many tribal and indigenous communities utilize tattooing as part of their religious ceremonies and is deeply integrated into their culture. About 24% of the U.S. population has a tattoo. While tattooing can be very positive for an individual, it brings people a lot of joy, and in certain circumstances, it actually can really enhance an individual's quality of life. However, there is a dark side to tattooing. There are situations where tattooing might not be such a good idea, and there are things you should know about how a tattoo can go wrong. So that's what this video is about. No, it's not to bash tattoos, but it's merely meant to shed light on some things that you may not be aware of. But before we get into all that, did you guys know there are actually 5 different types of tattoos? There are decorative tattoos, which is probably what comes to mind when somebody tells you, oh, I'm gonna get a tattoo, right? It can be small, it can be large, it can cover a huge area, like you can have an entire sleeve, it can have multiple colors. Then there is cosmetic tattooing, which is essentially tattooed makeup, whether that be lip liner or eye makeup or having your eyebrows tattooed on. Now, this can be a convenience for an individual to not have to do your eyebrows every day or put on lip liner, but it really can be a game changer for some patients who develop certain neurologic conditions that make it very difficult for them to apply their makeup. You can imagine if you're somebody who loves makeup and it has been a part of your life, you know, forever, and then you develop a condition like Parkinson's, which makes it very difficult to apply your makeup. Well, tattooing makeup on can really just be a huge thing for those patients. Then you have corrective tattoos, which, as it implies, corrects something that might have been taken away by a disease process or surgery. For example, you can have corrective tattooing of areola or a nipple in the case of having had a mastectomy and the reconstruction. For patients who have vitiligo or scars that take away the color in their skin, tattooing flesh-colored pigments into the skin can help camouflage that. And also, some patients who have hair loss end up pursuing scalp tattooing to kind of mask the areas where they have substantial thinning. Then you have boring medical tattoos. They're boring because, well, they're not anything that anybody is going to look at, and they usually are not like a fun thing to get, but basically they just help to demarcate areas of the body where a patient might be receiving radiation therapy. Last but not least, you have a traumatic tattoo, which can happen as a result of things being implanted into the skin around an injury. Say, for example, you fall off a motorcycle or a bicycle. Any kind of explosive can leave behind sort of a tattooing effect where you see like gray dots. Again, not a fun thing to get. That doesn't bring anyone joy, but it is a type of tattoo technically. So who should not get a tattoo or reconsider a tattoo? I don't recommend getting a tattoo while you are pregnant or breastfeeding. Not because it's necessarily going to be harmful to your baby, but rather, God forbid, a complication arise. Being pregnant or breastfeeding can limit the available treatments. So it's just a good idea to hold off. Not to mention the skin changes a lot during pregnancy and breastfeeding. There are a lot of little subtle changes that might negatively impact tattooing for you. For example, a lot of women develop more hyperpigmentation, they bleed more easily. So it's just not necessarily the best time to get a tattoo. I would wait until after pregnancy and after you're done breastfeeding. That's not to say that if you plan to have children in the future that you can't get a tattoo in between. It's just while you are actively pregnant or actively breastfeeding, it's not a good time to get a tattoo. The other people who should seriously reconsider getting a tattoo are patients who have the skin condition lichen planus or psoriasis. Now I have videos on both of these, so if you have those, you're gonna wanna check out my videos on these topics. But if you've watched those videos, or if you know anything about these conditions, you recall or you may be aware of the fact that these conditions exhibit the phenomenon known as Kebnerization, or the isomorphic response. And that's fancy medical jargon for basically anytime there is wounding or injury to the skin. It can be something as simple as scratching or picking your skin. it will elicit more of that particular condition, whether it be lichen planus or psoriasis. So if you get a tattoo and you have one of these conditions, you can get an eruption of your skin condition within the tattoo because of the kebnerization process, and that may mess up the tattoo or just be very uncomfortable for you. Also, if you have a history of making raised thickened scars easily, if you make keloids, keloids are a type of thickened raised scar, I would seriously reconsider getting a tattoo, because I've seen many patients who went ahead and got a tattoo. They have a history of keloids and they get a keloid within the tattoo. And keloids, in contrast to hypertrophic scars, they put out claws and they can extend outside of the area of the tattoo in this case, or outside of the area of the skin injury. So I don't suggest getting a tattoo if you are prone to keloids. If you are on medications that thin your blood, anticoagulants, you might want to reconsider getting a tattoo because it does increase your risk of bleeding and complications. Patients who have a personal history or a strong family history of melanoma, especially patients who have a lot of moles. Why do I say this? Well, a few reasons. First of all, if you got a tattoo in an area with a mole, it could impact the mole negatively. But importantly, where you have a tattoo, you might not ever see a melanoma arising. A tattoo can mask a very concerning or worrisome mole and make it difficult to monitor for changes. Not to mention, God forbid you should develop a melanoma, tattoo pigment does travel to the neighboring lymph nodes. So should you need a lymph node biopsy, that can make interpreting the biopsy very difficult. No one plans to get melanoma, like it's not on our to-do list. But if you have a strong family history, you have risk factors for melanoma, I would rethink getting a tattoo, especially anywhere near where you have a mole or any kind of what we call a pigmented lesion, basically a mole. So those are folks who just might want to reconsider getting a tattoo, right? Or just like rethink, is this right for me? Or reconsider where you're going to get the tattoo or when you're going to get the tattoo. Those things aside, what can go wrong with a tattoo? What kind of complications might pop up which you may not know about and you may want to know about? First of all is probably something that they're going to tell you about, but you need to be really understanding of is anytime you cut the skin, take a needle to skin, there is a risk of an infection. And that definitely can happen with the placement of a tattoo. Now, ideally, in a perfect world, you would be getting a tattoo like under sterile conditions, but that is not the reality. That being said, most tattoo artists do go above and beyond to use really good technique because, well, it's their livelihood. And, if they have a bad outcome, it looks bad on them and it affects their business and they take a lot of pride in their work. But as with any profession, there are bad apples out there, and there are tattoo parlors where they do in fact not use the best technique, and you certainly can get skin infections. The skin infections can be quite varied. You can get a bacterial skin infection like a staph infection. That's probably most common, like an impetigo. I have a video on that. But you can also get infection with what's called mycobacterium, and they are a lot more difficult to treat. Then you can get infections with fungal microorganisms, viral. So there have been cases of hepatitis that patients have gotten from tattooing, and rarely, there have been cases reported of HIV. I don't say this to scare you, just to make you aware of the fact that, a needle coming in contact with the skin opens up the possibility of infection. Go to someone reputable in your area. Don't, if it sounds too good to be true, it probably is. And in this kind of thing, you're spending a lot of money to get the tattoo. The last thing you want is to have an infection on it. So go to someone who knows what they're doing. But likewise, you can have the perfect tattoo placement, no problem at the time of placement, but you can then develop an infection as the tattoo is healing. So you want to make sure that you are taking care of it, following the aftercare instructions to a T. The other complication I already kind of talked about is you can develop scarring, especially if you have a history of making keloid scars. Honestly, I would not get a tattoo if I were you, because the chances of you developing a keloid are, pretty high, and that's not going to be something that you want. Then the other big one is a hypersensitivity reaction, which is kind of a fancy jargony terminology for a type of allergy, a type of allergic reaction that is usually to the inks, especially red ink. Like a lot of people can develop an allergy to the red ink, specifically a component in it called cinnabar. You know, if I were gonna get a tattoo, I don't have tattoos, I would never get a tattoo with red ink just because that is a really common ink for people to become allergic to. That being said, there are plenty of people out there who have red ink in their tattoo and, you know, live their lives no problem. But for me, you know, that would be a color I would avoid. When you develop a hypersensitivity reaction, you can develop basically a foreign body reaction where the body tries to wall off something that it perceives as a threat. It can lead to chronic itch, discomfort, you can get ulceration, bumps within the tattoo, so it can be disfiguring and quite uncomfortable. Some pigments actually can trigger a photosensitivity, especially yellow. Yellow pigments have cadmium sulfide, which can trigger a photo reaction when you go out. The skin is exposed to UV, but also in some cases infrared radiation. And while it's in yellow pigments, some reds add cadmium sulfide to the red to brighten it up. So it could also be the red pigments as well. The next one is rare, but is definitely worth knowing about if you plan to have a tattoo. And that is, should you need to get an MRI? Very, very rarely, your tattoo can interact as you go into the MRI machine and cause a burn. First degree and second degree burns. How the heck does this happen? Well, tattoo inks contain iron oxides. I'm always talking about iron oxides in tinted sunscreens because they, you know, when applied to the surface of the skin, they offer some protection against visible light, but they are incorporated into tattoo inks and placed, you know, in the top part of your dermis as part of the tattooing. As a side note, no, they are not offering you visible light protection when they're placed in a tattoo. But anyway, all that yammering aside, what can end up happening is that it creates this field of electrical charge that can basically burn you. So if you have a tattoo and you're going to get an MRI, let them know, because you can actually apply a cold compress over your tattoo while you go through the MRI, and it will reduce the risk that you develop a burn. Another big risk, and I already kind of mentioned this when we were going over who should reconsider getting a tattoo, is that a tattoo can hide a skin cancer. It can hide melanoma, right? Like, you know, if you have a mold that's changing and it's within a tattoo, you're going to be less likely to notice it. If you get a suspicious, new, bothersome appearing skin lesion, a pigmented skin lesion, are you going to see it as well in a tattoo? That might take a while for you to notice it in the tattoo, so it's a delayed diagnosis. And when it comes to melanoma especially, the earlier you intervene, diagnose, the better the overall outcome is. But if it goes on, you know, if it's left there, then it's more likely to spread. So that's a concern. Not to mention, melanoma is not the only skin cancer. You can develop other skin cancers within a tattoo, like squamous cell carcinoma, basal cell carcinoma. These are going to be more common in sun-exposed areas, but it's definitely something to think about. Now, to be clear, it's not as though, at least from what we can tell, the tattoo is triggering these skin cancers. They are related to sun exposure, but they can happen within a tattoo. But very rarely, tattoos can cause what's called a pseudo-lymphoma reaction. So a pseudo-lymphomatous reaction is just what it sounds like. It's not full-blown lymphoma cancer, but it's kind of looks like it. It doesn't, you know, it's not harmful to the same extent as a true lymphoma. And it's called pseudo-lymphomatous because it involves cells of the immune system. They come in, they look abnormal, and they kind of look like a cutaneous lymphoma. I talk about skin cancer all the time, but I honestly don't think I've ever talked to you guys about lymphomas in the skin. But this isn't a true lymphoma. It is like it's almost a type of hypersensitivity reaction. And it presents with these plum-colored nodules that will arise within the tattoo. Speaking of pseudolymphomatous, what about frank lymphoma, frank cancer? You may have heard this recently in the news, that there was a paper that was published in the Lancet this year of a study looking at people in Sweden. They showed that people with a tattoo had a 21% increased risk of lymphoma compared to people without tattoos. Now, before you get all worried, look at your tattoo and panic. Remember, association does not prove causation. There are many, many people walking around with tattoos who do not have lymphoma. So whether or not it's causative or just guilty by association, we don't know. This was just published like very, very recently. Last but not least, a risk of getting a tattoo is you regret getting it. It's difficult to say how common this is. I've seen some estimates of 16% people regret getting their tattoo. You know, I think the younger you get a tattoo, maybe the greater the likelihood that, you know, when you become older, you regret having it, right? Because our tastes change, things that were popular change, you know, so it's not uncommon for people to get a tattoo when they're younger, and then whatever they had tattooed on becomes, you know, sort of passé, or maybe it was a tattoo of somebody they were dating at the time. So regret, and you can remove a tattoo, albeit it is painful. There are a variety of approaches with lasers to get rid of tattoos. It, you know, is costly and can be quite painful, and it takes time. It takes multiple visits. So that would be, you know, that's definitely something to think about. Just knowing that people do end up regretting their tattoos. And so really, really, really make sure that it's something that you feel you're gonna be happy with indefinitely. But don't get me wrong, tattoos, they can be a life-changing, a real positive thing for people. So this is not meant to scare you away, but hopefully in watching this video, you're just, well, more informed. Having information and knowledge, it really helps you make a better decision. If you have a tattoo, make sure you pay attention to it. You know, I have videos on my channel talking about how to do a skin check for suspicious moles, worrisome moles. If you have a tattoo, you definitely want to examine it carefully. And if there are any lumps, bumps, things that look bizarre, you know, something that appears to be there that wasn't there before, definitely bring it to the attention of your healthcare provider, because a lot of, you know, lumps and bumps can arise in a tattoo. I hope this video was informative, educational to you guys, and that you enjoyed it. If you are considering getting a tattoo, you're also going to want to check out my video on tattoo aftercare. I'll link it on the end slate. But if you guys like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.